Hi friends, welcoming you to masterclass number 3. In this masterclass, we are going to be discussing 3 important things. One is patient with multiple failed IVF cycles. Second, the patient has already had euploid embryos. Third is discussion on chronic endometritis. And fourth is role of immunology in such situations. Now, friends, this is a very crystal clear thing. God is very kind to me. I'm very fortunate that I get referrals from across the country to give second opinions on patients who have had failed IVF cycles, second opinions in whom commercially viable centers have advised to do LIT or any form of immunotherapy. This is a young girl, around 38 years old, from Rajkot. I have a huge referral base from Gujarat because I am Gujarati myself. This girl has done 3 IVF cycles. In the first IVF cycle, they did not do any genetic testing in the form of PGTA or NICS, and they simply transferred the embryos that failed. Her AMH value is good, it is 1.4. Husband parameters are normal, they are having unexplained infertility. Second IVF cycle, obviously, they went ahead and did PGTA, and they have a total of 7 euploid embryos which have been formed, which is a great thing, right? They transferred the first 2 embryos inside. It gave rise to a cardiac activity in the pregnancy. So, of course, everybody was very happy, but it ended up as an abortion. After that, they transferred 2 more embryos, and that did not give rise to a pregnancy. So, the obvious question which I was asked was, do we need to do an ERA in this cycle? So, guys, remember, ERA or endometrial receptivity array has no role any further. It does not give you the window of implantation which you are looking for. So definitely we have advised the patient to not do endometrial receptivity array. Of course, they are going to follow this. The next question which was asked to me is, because we have euploid embryos pending, do we need to do anything additional for the patient? So guys, these are the situations and cases where you have to remember that because you have euploid embryos and 2 times the euploid embryos have not worked out for you, you have now 2 options. Either you look at immunotherapeutic aspects for treating of fertility, or you also look at other aspects in the endometrium. In a country like India, the first thing which you should rule out in such circumstances and situations is chronic endometritis. That is basically a chronic infection of the endometrial lining. This is simply ruled out by doing a biopsy. The biopsy from the endometrium is tested for MUM1, right? And MUM1 is a very specific marker for plasma cells, as you are aware. If the plasma cell concentration is more than 10 per high-power field, you need to give the patient antibiotics. Of course, we have done this. She traveled from Rajkot to Mumbai just to get this done. So we have done this and we are awaiting reports. Now, simultaneously, our colleague in Rajkot had also tested the lady for her immunotherapeutic profile. That means APLA was done, anticardiolipin was done, ANA titers were done, thyroid was repeated. Most of the values were normal, but ANA titer was found to be slightly high. Just having ANA titer positive is no indication to perform LIT on a patient. So definitely before we perform LIT, we had advised the patient to look into CDC cross-matching. And the CDC cross-matching for this patient was positive. So that means there is no negative cross-match, which is a great thing. That means the patient has no indication for lymphocyte immunization therapy. So then what do we do? Remember guys, ANA positive titers can be easily maintained by giving either Visolone or HCQS, that is hydroxychloroquine, or Visolone, which is basically a steroid, which is prednisolone. In some situations, because euploid embryo transfers have failed for the patient, you may also have a role of giving tacrolimus to these patients. This role has to be discussed very thoroughly with a nephrologist in your transplant team, and it is ideally the nephrologist or a physician or a transplant medicine person who is supposed to discuss and decide what is the optimal dose of tacrolimus which the patient is going to require. So we have advised the patient that now await the report for chronic endometritis. If it is positive, we give antibiotics. If it is negative, do nothing. Consider to give Visolone along with hydroxychloroquine to this patient at the time of the embryo transfer. And if that fails further, Then we may consider to give the patient in its subsequent cycle tacrolimus, because tacrolimus should be used as a reserve drug in these situations and not as a primary drug. These are your real life situations which you are going to face if you are a fertility specialist. And that's the reason why I thought when we take master classes for fertility specialists on Instagram, we give you real life cases. Being a referral unit, because you know we handle so many of these types of cases, most of our advices is going to be core scientific with some amount of practicality inside it. Any more questions on this, I'll be happy to answer. You can post them on the comments and you will receive answers from me in the next 24 hours. Thank you so much.